Check, check. Checking audio out to stream. 1, 2. One, two. One more test. Check, check. One, two.
All right, well, I hope everybody has had some time to enjoy their lunch and is ready to come back in, sit down, and get prepared for our next session. So I'll give you about 2 minutes to make your way to your table. All right. Well, thank you all so much for hanging in here. We've had a lot of good discussion already, and I'm excited to continue that discussion with this panel. As we've heard many times this morning, well, you haven't heard this part this morning. My name is Samin Dadalahi, and I am the CEO and president of the Wyoming Community Foundation and the moderator for this session. So now I'll segue into many of the things that we've been hearing since this morning. And the bad news for our panelists is that every answer that you needed for the questions was delivered, from 8 to noon. So sorry that you missed that, but there was a lot of good information. But what we do know is that Wyoming's most critical health policy questions are deeply tied to our rural geography, our aging population, workforce shortages, and the financial fragility of small healthcare systems. The challenges aren't new, as we heard. We've been dealing with them for 30 years and longer. But what may feel different now is the convergence of all of those issues. New federal rural health funding presents opportunities for transformation. At the same time, changes to marketplace reimbursement, or insurance premiums, ongoing pressure on Medicare and Medicaid reimbursement rates, workforce shortages, and concerns about hospital sustainability are creating intense uncertainty across our healthcare landscape. For many providers, policymakers, and communities, it feels a little bit like a case of everything, everywhere, all at once, and I 100% stole that from the movie. We're fortunate today to have our 3 Republican gubernatorial candidates with us to discuss health policy. Their biographical statements are available in the back of the book, and I am not going to ask them to introduce themselves. Instead, I pulled a few things together with a little bit more of a healthcare lens, and so I'd like to give you an introduction that way. Megan Degenfelder has served as Wyoming State Superintendent since 2023. Her leadership has focused on strengthening literacy, expanding career and technical education, and improving student achievement across the state. Through these efforts, she's emphasized workforce readiness and creating stronger education to career pathways, including opportunities to help Wyoming's future workforce needs. As a 6th-generation Wyoming native, Degenfelder holds degrees from the University of Wyoming and the University of International Business and Economics in Beijing. Brent Bean is a Wyoming native, retired Marine Corps colonel, and combat veteran with decades of leadership experience in complex military and public sector settings. Over the course of his career, he's commanded large organizations, managed budgets exceeding $9 billion, and led projects requiring coordination among military, government, contractor, and civilian partners. As a career military officer, he also has firsthand experience with one of the nation's largest publicly financed healthcare systems, giving him direct exposure to healthcare access and delivery outside the private market. Bean previously ran for governor of Wyoming in 2022 and holds degrees from the University of Wyoming and the U.S. Naval War College. Eric Barlow is a veterinarian, rancher, former U.S. Marine, and Wyoming legislator. His career has centered on rural communities and public service. After earning a veterinary degree from Colorado State University, he returned to Gillette to work as a large animal veterinarian serving agricultural producers across the region. In more than a decade in the Wyoming legislature, including service as Speaker of the House and now as state senator, Barlow has worked on Wyoming's healthcare issues, including access to care, behavioral health, long-term care, emergency services, workforce development, and responsible state budgeting. I hope you will all join me in giving them a warm welcome. As governor, you will be responsible for guiding Wyoming's long-term health care strategy in partnership with the legislature. The challenges are significant, but so are the opportunities. We know that meaningful progress is possible when leadership, policy, and collaboration, and maybe the stars all align. The purpose of this forum is not to determine whether change can happen, but rather to understand how you will make it happen. We're going to begin today with an opening statement from each of the candidates. We're going to go in alphabetical order. I'd like you to think about the challenges you see in Wyoming and how they have shaped your top healthcare priorities for the state. Okay, I might have to move you along if you get a little too expansive, but otherwise, Senator Barlow, please take it away.
Well, thank you very much for a little bit of your time this afternoon. It's a blessing. So I'm not sitting forward in this chair because I'm trying to run out, but if you sit back in this chair, you're going backwards. So let's just be clear about that. And just on the Colorado State thing, I was a witchy student, so I'm still a Wyoming. I was still a Wyoming person, all right? Let's be clear about this. Well, thank you for the opportunity to visit about healthcare. Now, all the experts in the room are out here or online, and I thank you for your service to Wyoming. And the upcoming experts, or some of them sitting right over, WWAMI students, and that's the future of healthcare in Wyoming. And I think that's how I approach, and I've had the opportunity, the pleasure, and the honor of serving in the Wyoming legislature. And when I came in, Speaker Lubno said, Eric, I'm going to put you somewhere where you're going to have to really work. You're going to have to really pay attention, listen, learn, and work from the folks and try to understand the opportunities and challenges that are out there. And I don't know that, he wished that upon me, and it has been such a pleasure because I have learned all along about the opportunities and challenges there are in healthcare in Wyoming. And in those different roles, both in the legislative roles and then in the community, because this isn't just about being in the legislature, it's about what you actually learn in your own community. So I'm self-employed, right? If you're self-employed, that means you know the real cost of healthcare. You make real decisions about healthcare. And sometimes you're self-insured too, right? There are real challenges in Wyoming healthcare, in the Wyoming healthcare. But you folks, what you deliver, what you do every day makes a difference. It makes a difference in your families, it makes a difference in communities. And we can talk about what healthcare is, but it's at its most basic form, it's a provider and a patient in a room trying to improve someone's life, heal them, give them opportunity for a better life. And then we go outside that room and it gets really complex, right? The payers, all the different things that go on. So I'm going to continue as governor showing up, listening, learning, and doing the work that makes a difference. It's what I've been doing as a legislator. It's what I do in my own community and supporting my own community. It's what we'll continue doing. I know there was a question in there somewhere, but that's where we're going to lay for the groundwork, and then we'll go to the questions. Thank you.
Colonel Bean.
Folks, thank you very much for this opportunity and just for the time today. And I love to see the young folks over there doing this. My wife's a nurse. She's been a nurse for well over 30 years. I've got a daughter right now who's doing a second career right now in nursing over in Cheyenne. So I'm really happy to see what's going on with the WWAMI program. And folks, to me, it's about priorities. It's about making sure that we stay focused on the prize, and that really is the people and the provider. And we know that there's layers and layers of bureaucracy across the entire healthcare spectrum, whether it's nationally or whether it's in the state. And my job as the governor, I'm a results-based guy, and my job is to at least reduce or really target some of that bureaucracy to where we get it out of the way, because we know here in Wyoming with our vast distances, we know accessibility to care is challenging. We know that specialization and the wait for it is also a challenge. But here in the state of Wyoming with our low population and our immense wealth that we have in the state, there is no reason that we here in Wyoming can't have the model program nationwide. There's no reason at all. And that's going to be my focus down there in Cheyenne. And I look forward to working with you guys. I mean, I've met so many healthcare professionals around this state, and I've told them, I said, I just want to get you guys in a room, take your cell phones and say, this is what I want to have happen. And it's really, legislatively. And it's really been a privilege, but it's really been really interesting to see really what the problems are from the ground level, kind of where you guys are doing this. And that's what we need to do. It's a matter of framing the problem or problems and coming up with those courses of action to fix them, but to have the will to do it, to truly have the will to fix this. Because I know that we can, but it's so big, and you guys know it's big. I mean, it's really like a feather trying to turn an aircraft carrier. That's how big this thing is. But I know here in Wyoming that we can. I know we can, and it's a matter of listening and working with you guys, and really trying to get rid of so much of this bureaucratic red tape in the whole healthcare process. But again, my focus is on the people and on the providers, and I look forward to working with you guys.
Superintendent.
Well, good afternoon, everyone. It's wonderful to be here with you all, and thanks for joining in this important conversation, because the race for governor really is the race for the future of Wyoming, and I believe firmly that we have a decision to make, and whether we go down the road of accepting the status quo, or if we decide that Wyoming is truly meant to lead. And that question, I think, is especially important when we look at our challenges in healthcare. And when we talk about healthcare, it is about our patients, it's about our providers, that relationship, we all know that, but it's not just a patient, it's not just a healthcare issue, this is an economic development issue, because healthcare is foundational to the entire state and to our future, because if we don't have adequate healthcare access or affordable healthcare, then young people continue to leave. And if you're like me, you're really tired of young people leaving the state of Wyoming. We have to crack that nut. We have to ensure that our young people here stay in the state of Wyoming. And all of you, like me, are intimately, involved in the healthcare industry for one reason or another. I'm a cancer survivor myself. I lost my mother far too early because she was on a wait list and couldn't get access to the care and the specialized care that she needed. And my husband is a provider. He's actually just working a block away in the hospital right now as we speak. And so I come home every night to someone who lives in this environment and are dealing with the challenges that you all face each and every day. And so as we look to solve these complicated issues, this is tough. This is a national issue. Just yesterday, I was having a conversation with the governor of Montana and Mississippi. And so when we talk about this issue, it's across the country, and particularly so for rural states and the challenges that we face. And so we know the goals, right? Overall is increasing access and it's reducing cost. Okay, sounds simple enough. How do we do that? It's tough. And it's a lot of different issues that I'm sure we'll go into later in this conversation. But I think what we really need from the chief executive is to set the tone and bring everyone together and decide what is our statewide strategy, what are our goals, and prioritizing those goals. And then we start to work at those together. And we take our policy experts, coupled with all of you that are experts in the field, and we're able to do that, to find those solutions. And so for me, it's really about focusing on workforce pipeline. That one is first and foremost. Number 2 is about how we have coordinated efforts, regionalized coordination. And then number 3 is telehealth. And there are many other issues beyond that, and I'm sure we'll get into those. But we have to start somewhere in prioritizing and in looking at how we approach the actual issues that we're facing. And hopefully we can talk more about workforce pipeline. That's something you all know in my role as superintendent that I'm extremely passionate about, because we can have all the programs, all the services in the world, but if we don't have the people to operationalize them, nothing else matters. And so leaning into that, and not just, I know there was a great discussion earlier today with our higher education partners, but how do we bring in K-12? Has anyone in this room heard of HOSA? Okay, a couple, but it should be the entire room, right? HOSA is a career and technical student organization for kids in K-12 that are in the pipeline for the healthcare fields. And so we should all know and have an intimate relationship with that program. In any case, I'm looking forward to really diving a little bit more deep into these issues. I think bottom line, we need bold, unapologetic leadership in the state of Wyoming. We were the first state in the country that granted women the right to vote, and the rest of the country followed. And that's the type of leadership it takes to really work on these complicated issues.
Thank you. I just want to preface the next few questions with letting you all know that in order to encourage thoughtful and substantive discussion on topics that are incredibly complicated, the candidates received this next series of primary questions in advance so that they could prepare some responses. We also have follow-up questions that were collected from individuals that are in attendance here today, and they have not been shared with the candidates. And I'll let you all know when we move from the questions that they received in advance into the questions that they're ad hoc having to respond to. So the first question that we're going to start with, because this is a candidate forum, we want to start things off really easy, is what is the appropriate role of state government in ensuring Wyoming residents can access affordable and quality health care? And where do you draw the line between government responsibility and individual or market-driven solutions? So appropriate role of state government, and where do you draw that line? Colonel Bean, why don't you start us off?
There is a role, obviously, and I think so much of that comes down, we want to try to push that a lot down to the local level naturally, but at the state level, we got to make sure that, we have that emergency preparedness. We got to make sure, we've got the communicable disease type of information out there to the folks too. And I mean, there's certain things, standardization across statewide, where government, statewide anyway, should be involved. And a lot of this, when I look at personal liberties of people, it really does come down to the government can't guarantee outcomes. Okay, we can't. And we wouldn't want that anyway. But once you start going down that road of guaranteed outcomes, of course, the trade-off there is personal liberties, and the cost and those kind of things that go on there. So I think this is the balance when it does come down to healthcare. Now, my objective here is really to eliminate a lot of this bureaucracy as much as I can. So I think with government's role as the overseer, kind of the referee, right, to make sure there's a level playing field out there, particularly for the free market to work, then that's where we got to focus. And I think, as I look into this, when I look at doing gap analyses and figuring out really what's going on out there, that's one of the things I want to focus on, which will be, a theme, I guess, to a lot of the things I look at is, okay, what do we really need to do here? And so, we have over 73,000 regulations on the book in this state. So how, a lot of people in here, and I know myself, it's like, do we really know what these regs stand for and what they really mean? So we got to look at what's relevant, what's not, particularly in the medical field, and then start cutting that down. But my focus will always be on the individual liberties of the people, bottom line, and then of course what it takes to provide that health care to them, and that's the health provider. So I'd like to push as much down to the local level as we can, simply because the local level knows, particularly in this rural community that we know as Wyoming, on what's best for that area. And then of course listening too, because it's a two-way street when it comes down to communication. And we got to be able to listen, particularly at the state level, and not become tone deaf like so often happens. And this is one of those things where we have recurring conversations all the way through it to define what those requirements are, what capabilities we have, because we know it's a very fluid environment out there. And we know that something could be right around the corner, whether it's another pandemic or whatever it is, and we want to make sure that we can get that information out to the folks as soon as we can. So, yeah, there is state oversight, primarily as the referee, but I'd really like to keep that down as much in the local level as we can.
Okay, so we're hearing from you, overseer, and focusing on local control. Senator Barlow, when we think about the role of state government, and we're talking about healthcare, and where do you draw the line? We know that infrastructure is a big part of that. So if you could, again, talk about the role of state government, where do you draw the line? And think a little bit about what the Colonel said in terms of how much you can push on to locals.
Sure, thank you, Samin. So the role of state government is probably twofold. One, to ensure that the services being provided in the healthcare field are safe, right? That the standards are being met, that credentialing is done through the boards, et cetera. That's a foundational thing. That's a consumer protection type of thing. That's a state role. The second role, and you judge societies by how they take care of their most vulnerable, about how they take care of those that don't have the same opportunities. So another fundamental state role, in my view, is the safety net. The safety net for those that have disabilities, the safety net for the poor, the safety net for the elderly. Those are the type of things that state government has a responsibility to. That starts, and those that are mentally ill. Those start in our Constitution, right? We look out for those things. For many of us, it's a part of our faith. And then through federal law and state law, programs are developed to do that. And many of those federal laws, or the state of Wyoming, is the actual, they actually implement it. But the services, so if it's Medicaid, let's just take that as an example, it's a cooperative program that takes care of folks. 70% of the nursing home beds in the state of Wyoming are paid for by Medicaid. So that's a lifeline. That's a safety net for folks, so they have good quality of life. Our elderly have good quality of life. Children in our foster care system, we provide their health care. So those are the things the state of Wyoming has a fundamental obligation to do in taking care of those folks. And so you can talk about that. Now, when we talk about the local level of government, all those are subdivisions of the state of Wyoming. County Memorial Hospitals, counties are a subdivision of the state of Wyoming, right? Counties choose to say, we're going to have a hospital in our district, in our community. And then you go at the next level, another level of government, obviously a outgrowth of state government authorization, is rural healthcare districts. It's hospital districts. It's ambulatory districts, all of those things too. And that's where citizens in a community say, we want to have these services, and we're willing to be a part of that. We're willing to put our skin in the game and be a part of that. So Wyoming has a myriad of different types of healthcare systems based on the community you're in, but the state role is to make sure we have some of the basics available. The basics available to folks that are less fortunate for whatever reason have access to care, meaningful quality care. So that's how I'd approach it from a state level. Now, what's a governor's role in that? Well, you propose a budget. You propose a budget that advances those things. And you work, and that budget obviously has policy ties, policy implications. So then you work with the legislature and say, what are the things we need to do to actually advance these policies that take care of the safety net and then the other opportunities that come out of there. And look, even the safety net, even the programs that are funded through the state of Wyoming, they're being provided in the free market. They're being provided by providers out in the community, except for those circumstances like the state hospital or the Life Resource Center. There's a few circumstances but the majority of them are being provided in the marketplace by providers who are providing for other people as well. So thank you.
Superintendent.
So of course, first and foremost, the government is not meant to run healthcare, but it is meant to create the conditions that the healthcare industry can really thrive and to be a partner in that. And so first and foremost, that's been discussed is public health and safety. That's providing public health. That's providing our emergency services. That's our licensing, safety for individuals and patients. And so that is first and foremost. And then second, I would dive into infrastructure. And again, that's back to setting the conditions where the healthcare industry can thrive. And that starts with basic things like broadband internet access. We're going to talk a lot about telehealth, I'm sure. And so do we have the accessibility that patients can be able to see providers in that new mechanism, let alone having cell service across the state for emergency services? Those are baseline infrastructure that the government should be providing. And then I would say another huge one that kind of gets left out of this conversation and why we find ourselves in a workforce shortage, education. Our government is responsible for our public education system, and to have a strong public education system that prepares students for that jobs and the needs that we have in the state of Wyoming. And that's in K-12, that's through higher education. And then I would take it even further from safety and infrastructure to coordination. I look at the role of the governor and the state government to bring the players together and have a statewide strategy. Where are we going when it comes to solving these complicated issues in healthcare? Do we have the experts at the table? Because as we see in education, we want autonomy, right? All of our different communities are very different. Our different hospitals have different challenges and needs. But we do need a mechanism to come together to share best practices, to talk about how we do make improvements in our government structures, to make it easier for you all. And so bringing you together, bringing the experts to the table rather than just working in a silo that is the capital of Cheyenne. And then I would say too is all about having that voice together and creating policy and working together of how government can get to yes. I've now run one of the state's larger state agencies, and I can tell you, you need a mindset shift within state government and in federal government of how do we get to yes? How do we think about who are we trying to serve? And sometimes that means doing less or being more quick. How do we ensure, I talked to a pharmaceutical company yesterday about how do we streamline processes for a non-opioid pain medicine to be on the preferred drug list? Why is it taking over a year to do that? How can we speed up those processes? And so I would say safety, infrastructure, coordination, and policy.
Thanks, Superintendent. Senator Barlow, every candidate says healthcare is a priority. What is the one specific concrete commitment you're making to Wyoming voters on healthcare? And what makes your approach meaningfully different than other people that are on the ballot?
So when we're successful on August 18th with the Republican primary, on August 19th, we will implement a statewide call for communities at the level you deliver care to come together, and let's call it a strike team. What do you need at your community? Then you build that out to a regional level, and then you bring that to the state, and then we work together to figure out what the right connections are, what the right pieces are. Look, we can all say, let's all get together, let's all talk about these things, but it hasn't been the last 12 months, 10 months, excuse me, feels like 10 months that I've been traveling the state. I've been working with many of you for 14 years on healthcare policy and having honest discussions about the challenges we have. Relationships matter in Wyoming. They say we're a small town with long streets, and in each of those neighborhoods, there's different challenges and different opportunities. So you help identify those, let's focus on them, let's prioritize them, and then let's keep working together to build up the system we need. Now why me? What gives me maybe an advantage? Relationships and results. There's a couple of questions later about what has actually the legislature done. Actually, dozens and dozens of bills have been passed that incrementally help healthcare. But now we take a giant step and say, what do we need to do next? What is meaningful, and how do we make it happen? How do we make it happen in our communities, but more, how does the state support that work? And I believe I am uniquely positioned with the relationships and from my understanding of what some of those challenges and opportunities are to work with you to make that happen. Thank you.
You know, I just want to stay on something very quickly because Superintendent Degenfelder talked about really wanting to go out and gather that expertise and listen to what those people have to say in order to form policy. And you're saying the same thing, you know, your ability to go out and visit with people, understand exactly what their needs are, talk to the experts in order to build and make policy decisions and make healthcare in Wyoming better. Are we talking about something like the Wyoming Healthcare Commission again or the Wyoming Healthcare Authority? Or does that look different? And Superintendent, please.
Well, that's a great question, and my plan upon taking office is to create a Wyoming healthcare access and workforce initiative. And I think this will be in partnership with the legislature. I'm not sure now with the changes with the rural health transformation dollars if we still have this special advisory committee that the legislature had created, but to partner with that as well, because we do need a structured statewide approach here. And we can't just keep having studies or different listening sessions. This has to be an action plan with actual timelines and results attached to it. And that's exactly how I've operated as state superintendent of you create that. We focus in our priority areas. For me, as I mentioned, the 3 priority areas are very clear. And number 1 is to start with workforce and to start really looking at our workforce pipeline. And it's not just higher education, but K-12 and those pathway options starting as soon as junior high school. And looking at what we're providing in the space of career and technical education. And then HOSA, those CTSOs, where kids are actually involved in healthcare training as an organization, an after-school organization. And then reaching those target areas with incentives. We know incentives work, right? My husband was a graduate of the WWAMI program. And so how we refine those programs in areas that go beyond just our providers. And then number 2, as I mentioned, was around regional coordination, greater collaboration in regionalized pockets, whether that be referral centers, recognizing, one example I'll use that you all know in this room is we now find ourselves in a state with OB deserts. My husband is treating patients that are having to drive on I-80 in the winter to deliver a baby. That's a problem. You wonder why young people aren't going to be here. If I can't have a baby in my community, if I'm scared to be able to deliver, that's a problem.
Superintendent, I'm just going to stop you just 1 minute because I wanted to get Senator Barlow's take on that. So when you're talking about the relationship building and visiting communities and talking about experts, are you also thinking about an entity that would be able to pull all of that information together? Or what are your thoughts on that?
So I think one of the questions later is we've had lots of studies, we've had lots of commissions, we've had lots of other things. When the hell are we going to get something done? And in my legislative tenure, when somebody brought a problem to a committee or to me as an individual legislator, you go do the work. You go do the work, identify the problem, and then move something forward. If it's policy, you move a bill forward at the legislative level. If it's a budget issue, you make your case with the governor, and if they won't take it up in what they propose, then you bring an amendment on the floor. You bring an amendment on the floor to advance something. Here's an example. As I've been traveling the state, I go to Thermopolis, Wyoming. They have a rural training track program for residencies. They are training their doctors in their community, and those doctors are staying in their community, serving their community because they've learned the skills they need to serve in rural Wyoming. They were losing their funding from the federal government. So what do? We brought an amendment to the bill, to the budget bill, that provided them the funding, and it's a skin in the game. It's a match, but it's a skin in the game, and we left enough money so another hospital that wanted to could come in and say, well, you know what? That's a dang good idea. We should do that too. That's what we're talking about. We're not talking about something long-term, we're not talking about a 4-year plan. We're talking about let's get an action plan together. Let's figure out what's meaningful for your communities, for the state of Wyoming, and let's have a proposal in the supplemental budget in January of next year, and bills that are ready to go with legislators who want to carry those things that are meaningful for your communities, for the state of Wyoming. Thank you.
Thanks. Colonel Bean, I just wanted to give you an opportunity to talk about what's your one specific concrete commitment that you'll make to Wyoming voters on health care.
I've put plenty of staffs together in the past, and expertise from all areas, dissenting opinions, which I think is fantastic, because whatever the objective is, it's a matter of either going over it, through it, or around it. And that's what we got to do with this mindset with healthcare. I mean, we've got to change this paradigm on actually, no kidding, getting something done. And so, I always start with a baseline. I want to know is, we're spending $2.5 billion annually, on healthcare. So I want to make sure that dollar, is actually being spent statutorily for its intended purpose all the way across. And this is obviously a huge thing where we spend in healthcare. And, I also want to look, when I talked earlier about gap analyses, on what redundancies do we have, what gaps do we actually have out there, what are the requirements? Because so much of it's based on requirements. And of course, what our end state is when it comes down to this. And when I mentioned earlier that we should have the model for the nation, there's no question in my mind that we can do that. But it is a matter of getting the right people out there. So I first want to know what our baseline is. Where are we sitting fiscally? Where are we sitting with our gaps, right, if we have any? All these redundancies potentially that are out there. Let's start streamlining this. What kind of bureaucracy can we actually get rid of to streamline it for you guys, to make it more, because ultimately it's you guys providing that care for the patient. So, to me, it's all about leadership. It all comes down to what's the end state, what are we looking for, and how do we get there? But we've got to get the right people out there. And I tell you, with all the healthcare providers with whom I've spoken across this state, I mean, they are motivated. They're motivated to actually have some action. And folks, that's what I do. You know, I go out there, I frame problems, we come up with courses of action to do it, and then we fix them. You know, and it really does come down to the will and the determination to get it done. So, you know, I'm looking right away at, like I said, is figuring out where we're sitting fiscally, figuring out what the gaps are, figuring out what the true problem is, and instead of addressing symptoms like we normally do, is frame the problem. And it's going to be a host of problems, I get that, and they're going to be probably interdependent problems. And figure out, you know, what we can address right away, what are causal, solutions, those kind of things, and then finally get down to what our objective is. But, that's where I'm looking forward. Very, complete tenacity across the board, because I know how big of an issue this is in Wyoming.
Thank you. Senator Barlow, you did just mention that we've commissioned healthcare studies, task forces, policy recommendations, and reports going all the way back to the mid-1990s, so 30 years. And we know that we've made progress. We heard this morning from many people talking about some of the programs that have come out of that and some of the great work that we've been able to do in Wyoming to address some of the problems that we're still talking about today. So that's not the hard question, right? The hard question is, in 30 years, where we've had study after study that has told us what we need to do and has pointed to the solutions, the models that are available on the ground for us to emulate and for us to look at, why have we had a pattern of inaction or low-level action for 30 years? That's the hard question, and I think you're well-positioned to help us understand that. So would you please kick off that question?
So what the question doesn't have in it is, what are those shortcomings? What are those policies? So then that leaves us all guessing to what was in those reports and what were those shortcomings. I mean, let's just be honest about it. Some of you probably participated in those things. Maybe you remember them. But we haven't done that in my tenure in the legislature. There have been no major overhaul studies. We have been very focused and refined on very particular issues. So let's just take the telehealth, right? Telehealth. We adjusted telehealth, telemedicine, depending on where you are in the different Title 33 practice acts. We did it in one, we did it in another, and it's like, no, we've got to open up to the entire Title 33, all healthcare providers. So we did. That was a bill that I ran. Opened it up for any healthcare provider. So I guess, it's easy to say we haven't done this, this, and this, but what are those this, this, and this? And then let's talk about the policy implications. Let's talk about the tough discussions you have. I can probably think of one. How about 2003 and tort reform? Everybody shakes their head going, yep, remember that. These are tough, these are big and tough discussions. Medicaid expansion, right? So I was in some of these discussions, and there will be more of these type of discussions. But these are big policy things that if we're gonna get our arms around them, we all better get at the table, because they have profound implications. So we can say we haven't done what's on the shelf and it's all gotten dusty, and that's on us. Maybe it is. But when things do come to the table, direct primary care, probably 8 years ago, direct primary care came and said, this is a new model, delivering care in Wyoming. We need to exempt it from the Insurance Act. So we did. We wrote the bill. Fred Baldwin and I served together in the Labor Health Committee. One year we had 17 bills that came out of our interim work. All 17 passed. I'm not saying we changed the world, but we addressed things that came before the committee. We addressed things that came from the communities, from healthcare providers, and I believe they make a difference. They make it. It may be incremental, and it may be in smaller pieces, but that's okay. We make a difference. Now, those big things, that a couple of them that I mentioned, that's tough stuff, folks. Let's just be honest about it. And but I'd love to see the list. It's easy to say we haven't done anything, but I'd love to see the list. Then let's have a conversation about why some of those things didn't advance and the challenges they are, and how different the scenario, the healthcare system is right now, the scene we have right now, than it was 10 years ago, 20 years, and 30 years ago, because things have changed significantly. Technologies has changed, all those different things. So I push back a little bit on that we're not doing those things, because quite honestly, we're doing things. Public policy is changing, both at the federal level and the state level. If there's better and bigger ideas out there, bring them to the table. That's what we're going to do starting August 19th. and we'll be ready to kick them out the door right at inauguration. Thank you.
Superintendent, do you have anything to add?
No, I would just say, this happens in all areas of government, right? There's a lot of study, there's a lot of commission, and sometimes we piecemeal make progress, and we do a little here and a little there. But I think some issue areas that occur in all different areas is number one, not having a statewide collective strategy of where we're prioritizing. And so again, we chip away, but what is that holistic strategy of where we're trying to go? And then a lot of times, some of these reports or studies, they just become just that and not action plans and having actual directives of moving forward. And then you have turnover with your elected officials, and then they do end up on a shelf. And that does happen. And so recognizing that we need an action based on that to be able to fully implement them. And so I think that's part of it as well. And then a sense of urgency sometimes. Again, you have changeover of elected officials, and there's not this sense of urgency that it has to get done now. We're working on it. We're working on it. And then that's that mindset shift in state government that needs to occur. And what I'm really proud that we've done at the Department of Education is really shifting that and creating more of a sense of urgency and then a sense of accountability to that. That again, you're not just saying, this is a long process. We are chipping away at it. Sure. But where's the accountability on that? And again, we're back to that statewide strategy. And so I think that some of those are the reasons why we find ourselves in this place.
Wyoming has the fastest aging population of any state in the nation, and we've certainly had that come up multiple times this morning. In 2024, nearly 20% of Wyoming residents, about 116,000 people, were age 65 and older, and that share is expected to grow by another 10% by 2030. In-home health care and wraparound services that keep people in their homes are less expensive than residential care. Polling data collected by AARP of Wyoming shows that up to 85% of people want to live in their homes as long as possible. What policy solutions would you advance that promote independent living and ensure sustainability for existing long-term care infrastructure? Colonel Bean, why don't you lead us off?
Well, I'd like to answer that last one too at some point. No, I think home-based healthcare is huge. I think our elderly, our veterans. I mean, one thing that really bothers me. And I've been stationed all over this country, but I've seen it in all states. Is that we tend to forget our elderly. Okay, and these are the folks that built this state. They're the ones that built this nation. And I see it. I see it through my wife's profession and some of the things where she's worked, and that's really the big focus right now. Up where she's been in Cody and Sheridan is these seniors, these elderly veterans, and I have such a soft spot in my heart for them, and they want to live out, and particularly if they want to. Let's put it that way. If they want to live out the rest of their life in their home, we should fully support that. Give them the dignity to live out the rest of their life where they want to do it. And I tell you, it's with that, I think we have the opportunities here in the state to do it. And I think the focus really should go to that. With technology, we've got the telehealth, we've got those things that we can monitor, but we've got plenty of opportunities really to provide that hands-on, particularly at the local level, depending upon where it is. So with our elderly, I just have a different take on it, I guess, when it comes down to just the way I view them, I guess, and is just that they are the basis of this country. And what I've seen in a lot of cases is that whether they do go to a nursing home, and I understand some may, depending upon what they want to do, and this requires obviously a lot of family involvement too, responsibility with the family, to take care of the elderly. But in a lot of cases where they do end up in some sort of other care that may not be at home, is a lot of times it ends up being the bottom line, the profit margin, and I don't like to see that. I don't like to see that. Now that may be one of the an avenue where they go, but I'd really like to focus on the home health care as much as we can, and make sure that we have that specialized care that that we can provide if we can do it. And I think with technology right now we can. We can do a lot better, particularly with these remote docs, whether it's through telehealth, whatever it is. But it really comes down to their decision, their family's decision on what they want to do and what's in the best interest of them as they live out the twilight of their life.
Senator Barlow, would you like to follow up on that? Any policy solutions that you would advance to promote independent living and ensure sustainability of our long-term care infrastructure?
Well, there's basically two things. One, you have to have a workforce that's available to help allow those folks to age with dignity in their homes where they want to be the majority of the time. And it takes money. And the state of Wyoming puts money into the waiver program, into the home and base community services waiver, and through the senior services board. So it's about a budget. It's about a line item in a budget. If you provide the opportunity for services to be rendered, more folks will take care of them. I had the blessing yesterday of spending some time in a assisted living facility and in a long-term care facility, and those folks are there. But majority of our folks are aging in their homes, in their communities where they want to be, and there'll be a time maybe where they have to go there. The more support we give them in the community through our senior centers, through the waiver program, et cetera, the better off, the better for their lives, the better for their families, and the better for our communities. So it's a budget line item and it's workforce, those two things. And we can do something meaningful with that, and that's a governor's role. That's a governor's role, we got to add more money to this line item so we can deliver more services in the community for people to have better lives. Thank you.
And I'm going to follow that question up with just the flip side. So the outmigration of young people. Wyoming faces challenges in retaining and attracting work-age residents and young families. What role does healthcare play in that effort? And what specific policies would you pursue as governor to strengthen healthcare as a competitive advantage for Wyoming communities? Superintendent.
Well, and if I could too, just to follow up on the previous question of our elderly and how we keep them in our homes, it's not just about money either. I think a lot of coordinated care and in community care that we've started to talk about of how we work together, where it is telehealth, but if they even have access to it. I know with the telehealth survey, we saw that some of the biggest issues were even being able to have internet access and know how to use it. But then also to be able to transport our elderly. I know in Basin, they're doing incredible things, have decrease the trips by thousands for elderly, mobile services, care coordination with our EMT, with our pharmacists. Anyway, so I just want to say, I think there's a lot more there of than just money of how we coordinate those efforts. But then on the flip side, so how do we keep our young people in the state of Wyoming? Because now we're going back to our workforce. And I always say, we start by letting them lead. We need the next generation to start tackling these tough issues and be part of this conversation. And they need to have a community where they have a good job and they can afford to live here. And then they want to be here, and they know what opportunities are here for them. And so that's starting with a strong economy and having jobs available to the spouses of our healthcare workers, because you all have experienced that, where you might have the provider, but not the spouse on board. And then affordability of our communities. And then we get into housing and that discussion of, can you even afford to buy a house as a young family in the state of Wyoming? Can you afford the taxes associated? And so those are a couple of the things that are critically important, but it's also having exposure and getting their buy-in early on. When you have some of these programs where they get involved, they're working in a hospital or have an internship as a high school student or in college, they have some of these incentive-based programs that bring them back. Those things work. They fall in love with a hospital, with a community, with the people they work for. And so those type of programs are extremely important to keep our young people here.
Senator Barlow, would you like to follow up on that? What can we do to strengthen healthcare as a competitive advantage to keep young people and working families in Wyoming?
So I guess let's talk about the role of state government, what state government is doing now. I mentioned the WWAMI students. We have nursing programs in all of our community colleges and at the University of Wyoming. We have a pharmacy program. We're expanding health professionals. We have WICHE program, et cetera. We also have to have, and many of you as employers, talking to different hospitals and you're actually giving the folks that get a CNA, what's the next step? Do they want to get a nursing degree? What are those things that you can incentivize for people to grow their capacity, to grow their ability to earn that living, to be more meaningful in their community? So you do that at your level, at the community level, and the employer level. The state helps support some of those much of that with programs for nursing, et cetera. So it goes together. Look, healthcare is a big part of our economy. let's be candid about it. Healthcare is a major part of the economy, and it's going to continue to be a big part of our economy. So young people, opportunity is there, even second career type folks. How do we give them those opportunities? And it's partnerships. It's partnerships in education through the state of Wyoming, and employers saying, how do we grow you? How do we grow you so you have buy-in here, so you're part of this community? Look, we educate WWAMI students, and they have a 3-year obligation, right? 3-year obligation. 3 years, you know, they could move on from there. So how do we actually extend that 3 years to 5 or 7, not adding for them, but by incentives so that they are putting down roots then. They are saying, this is my community, I've found my place, I've found my tribe, etc. That's why that program in Hot Springs County, I think, is so powerful, because they are literally growing, training what they need for their community in a meaningful way. And I know many of you are doing that. The state of Wyoming is a partner in that. The state of Wyoming is a partner in that with these programs and the opportunities that we help and fund and partner with you on those things. So there you go. Thanks.
Colonel Bean, anything to add?
You know, folks, as you know, this is nothing new. We were actually looking at some old minutes from some old UW Board of Trustees meetings from back in the 60s. And in the 70s and of course the 80s. And it was a problem then. You know, it was identified as a problem. We know that these young families, when they come here, they're going to be looking for economic opportunity. They're going to be looking for great schools. They're going to be looking for that access to good health care. And of course, they're going to be looking for low taxes. And you know, we here, as we kind of touched on it, it costs a lot of money to buy a home in the state of Wyoming. We know that residential property tax has just screamed through the roof here over the last 6 to 7 years. And, you know, and that was one of the things that I took to heart a few years ago, is that this was one of the issues that people were having such a problem with, was residential property tax, whether it was the elderly, because we have such a, you know, 42 or so odd % of the state is on fixed income. And we are a blue-collar retirement state, and that's one thing that makes us so great. But it is very difficult to stay here with the taxes that we have, and of course we know that the insurance burden on that for full replacement value and all these other things is a big thing. But that is why I led that ballot initiative to cut residential property tax by 50%, which will be on the November ballot. And a lot of you guys may have signed it or helped in here, and I appreciate that very much. But it's one of those things, my objective was the people, is to try to keep them in their homes. And because I knew young folks, young families, that actually left the state of Wyoming just over the last few years, because the taxes had gone up so dramatically. And it's just one variable in that equation. It's just one variable. But, you know, when we look at these young families, particularly who are going to have kids, whether it's the access to paternal care, you know, the child care, those kind of things, and the distances, whatever they've got to do, you know, those are some of the variables that go into that on whether they're going to stay here or not. But I will tell you that, you know, in certain cases, we all know that we're going to lose some of these folks anyway. You know, some are going to go to Florida, some are going to go to Texas, some are going to go to California. That's just the way it is. And the hope is that we get them back. You know, so they go out there, they explore the world, they see the world, they do these kind of things around the country, they get that experience. I mean, there's a doc that just is up in Cody right now who's been gone for quite a while. He's originally from Cody, who came back. You know, I mean, I did. Shoot, I was gone for, 28 and a half years. You know, came back to this incredible state. I never gave up my residency, though. And I just love it, and it's such a great state. But there's a lot of things we got to look at there. But bottom line, it's so much of it deals with economics. It really does. And I think we got to get a cap on that, kind of figure out where we're going as a state, and that all these things play together between that, healthcare, and obviously our public education.
Colonel, you really teed up that next question about property taxes. Superintendent Degenfelder made the comment about how many young families are going to want to move here if they feel like they can't have a baby safely in a hospital. And when you are such a huge proponent of the reduction, the 50% reduction in property tax, that decimates a lot of the healthcare services that we've been talking about today, particularly at a local level. We have an incredibly fragile rural healthcare infrastructure. Our rural hospitals really count on being able to have some of that revenue, and it pays for emergency medical services, public health, so many of those things, the backbone of it's all resting on property taxes. So that dynamic tension that you're talking about to bring young families to Wyoming and not have them have the burden of high residential property tax versus the need for property taxes to pay for these critical services in our community. Tell me a little bit about how you think those two things can be balanced.
Sure, man, that's a fair question. I think when we look at property tax as a whole, it's a big pie, right? Residential property tax is a piece of that pie. So, that's what we were going after. We know that back in 2024, Amendment A passed, which allowed the legislature to break out residential property tax as its own taxing category to where it could set its own rates. And we know that money goes toward and stays in the county, stays locally. But we also know that these counties have excessive reserves. There's a lot of reserve money in there. And so, there is a balance. There's no question there's a balance. But, when it does come down to it, what are the priorities? My number one priority there was to keep people in their homes in the state of Wyoming. Number one, to keep people in their homes. I think everything else beyond that is supplementary. Now, I will tell you this, when it comes down to the essential services, whether it's fire, whether it's the police, whether it's EMS, whether it's the dispatch. In fact, I was just down at L+C yesterday going through the whole dispatch center. It was really quite an opportunity. And those things are essential services. I mean, those things should be funded. And there's plenty of money out there to do that. So I think it just comes down to we need to, and this is where we look. Anytime we have a downturn in the economy, we got to look first at not overtaxing the people, but start looking at cutting government, covering government spending, and potentially the size of government, because it is huge. I mean, we've got the largest state government per capita in the nation, and we have significant spending along that, all down through the local level. So there is a balance there, and that's one of the things I'm looking at. But again, my objective there was to ease the tax burden across the state, knowing our demographics, primarily blue-collar retirement, to allow these people, if they want to sell their home, they can sell their home, but they shouldn't be compelled to sell their home simply because they can't pay their taxes. So that's what we were looking at, and that's why there was such a push for it.
Superintendent Degenfelder, your view on property taxes, some of the lowest taxes in the United States, and their role with community health. Tell us a little bit about what you're thinking and how you would weigh the funding required to sustain access to health care in Wyoming against tax relief.
Sure. I mean, like all of us, I want property tax as low as humanly possible. And with valuation just skyrocketing, it has been very difficult. And I supported the 25% reduction by the legislature because people were being forced out of their homes. They needed to be able to stay in their home and afford those taxes. And so I want those as low as possible. I also will not compromise on basic goods and services because I want to have low property taxes on my home, but I want an ambulance to show up when there's an emergency. I want a fire truck to show up when there's a fire. And I've made in my mission the last couple of years to reduce state budgets. I was only one of 2 state agencies that brought an overall decreased budget to the legislature this last budget session. It's tough. You got to roll up your sleeves. You work hard at it. So I'm always game to do that and continue to. When you look at local funding, you need to also recognize, though, the different funding streams, the different pots of money. And I won't get too in the weeds, but I mean, there's a difference between a general fund and an enterprise fund and where those slush dollars might be. And same with our permanent funds of how they fund schools. And so this is complicated, right? How do we do this, though? To your original question, how do you keep property tax as low as humanly possible? And then how do you make sure that we have our basic goods and services? And because of our tax structure, and I've spent a lot of time, I was on the Taxpayer Association board for many years, there's really one solution with how our tax structure is set up, and that is the mineral industry. And I spent my career working in coal and oil and gas, and every single person in the state should be cheerleading the mineral industry. Because when that industry does well, we all do well. And we can achieve those things. We can have both things if we have a thriving mineral industry. But we are so owned by the federal government that can change depending who's in the White House. And so again, I'm getting down a rabbit hole. But all that to say is that we have to have a thriving mineral industry. We need to develop more Wyoming energy. And we need to ensure that happens in the state of Wyoming so we can keep our taxes low and still have those goods and services.
So focusing on the mineral industry and not diversifying our tax base is what I'm hearing from you.
Yes and both.
Okay.
So, we talk a lot about, and so now we're going to another rabbit hole with diversification. We talk a lot about that. And I think for too long, we talked about diversifying too far away from the mineral industry. And really, because the way our tax structure is set up, that doesn't end up helping us. Sometimes it's a pull on our tax structure. And so what I'm interested in is really focusing on what we do best and then looking at value add. So looking at processing, looking at manufacturing to support that industry, direct and indirect, so that we really can withstand the boom and bust of our mineral industry.
Senator Barlow, same question. How would you weigh the funding required to sustain access to health care in Wyoming against tax relief?
So I think fundamentally, property taxes are all local. They support local services, K-12 education, your cities, towns, and counties, and special districts. I am not supportive of the 50%. The Wyoming legislature has already done 5 things that have been targeted and measured and meaningful. Going further, who gets harmed the most? The communities that voted to tax themselves to provide services for their community, whether it's a rural healthcare district, a hospital district, all those types of services, EMS district, all of those types of things. Those are the folks we're saying, you chose to have these services. Now we're saying you're going to get less money and you're still going to have to provide. We still expect you to provide the services. Now the state of Wyoming has an obligation to K-12 education. So when taxes go down, guess what? The state of Wyoming's obligation goes up. And we have that constitutional and moral obligation. Local governments, they can grow their economy and state as well. If the economy grows, sales tax goes up, rises the boat. Guess what special districts do who are actually providing services in the community? You get a bake sale. You get a bake sale because you have no other opportunities to generate broad community support revenue for what you chose as a community, your community chose on a ballot to support. So we're actually hamstringing those basic services at the most fundamental community level when we take these large, big bites at the top. Now, this is completely up to the voters on the November ballot. This is the folks in this room and your communities get to decide this question. Think closely about it, because the services that you value at your community that you chose to implement and go forth with, those are the ones that will be most profoundly impacted. And look, in Campbell County, it's not that big of an impact because we have minerals. But in other communities, much more reliant on residential property taxes. So it matters. Location matters. Where you are matters. But you, as voters, get to make the choice in November. Just keep in mind, you as a community also made choices prior to that about what you wanted to see in your community. Thank you.
Thanks. Colonel Bean, your campaign platform centers on 5 pillars, but healthcare and the economy don't appear on that list. Yet Wyoming's rural hospitals are among the state's most important economic engines, generating jobs, wages, and local tax revenue in communities. What would the Bean administration do when a rural hospital is on the verge of closing down or closes down a critical service like obstetrics, and it negatively impacts the community's ability to support the things that are named on your platform, like education and energy?
Well, I think we'd have to figure out why. Why is it actually going to shut down here? And get to that root cause on what's going on. We've seen counties dying across the state, and what I will tell you is healthcare is fundamental. I mean, it's foundational to all 5 of my pillars. That's returning taxes to the taxpayers, education to the parents, elections to the voters, agriculture to the growers, and energy to Wyoming. But when you look at a county like Carbon County, I mean, that county's dying. It's dying because our energy policy is upside down. And we're seeing that around the state. And I will take issue with this is when it does come back to these counties and special districts are sitting on piles of reserves of money here. So this does come down to changing the funding models, updating and bring them into the 21st century on how we can better fund these critical services, and healthcare being one of those. And I think it's critical down at the local level, particularly in these very rural counties like Carbon County, I mean, you go to Hannah, you see these things in Medicine Bow. I mean, these things are dying. And I think this is a matter of kind of going back to one of those questions where we've done so many things, so many studies in healthcare all the way through, and nothing's happened. And granted, there have been a few advancements, but it really does come back. Obviously, people get elected every 4 years or 2 years, depending upon what the cycle is. So we change out folks, but it does come down to the will to do it, and the executive leadership to carry it through. That's setting the tone. The governor sets the tone for the entire state. And I will tell you, healthcare is a huge thing for me, but it's foundational to all of my pillars. Because, I mean, we have to have that healthcare across the state to make those work. I mean, it's just foundational. So that's how I look at it. I mean, these are the more specific things, that my pillars that I talk about. But it's all economically based. It's all focused on those kind of things that we were just talking about, on trying to keep those young families here. So it's foundational.
Pam Thayer's really smiling a lot. So I think we've got a few people that would disagree that we've got counties that are just sitting on money. Can you give us a little information on what has informed your opinion on how much money is available out there that is just...
Well, the Wyoming Department of Audit, we've looked at all the numbers, so we've seen that. We've seen there's a lot of numbers out there.
Okay, thank you. Superintendent Degenfelder, your healthcare platform includes expanding scope of practice for non-physician providers. As Wyoming has already done significant work in this space, just give us a few specifics on what you mean. Which providers are you referring to? What additional scope of practice authority are you talking about? And why do you think they need it?
Well, we have done a tremendous amount of work in this area already, and Wyoming has really led in that way, which is good. And this is always a balance. We want to make sure that folks are training to the highest of their potential, and in their practicing to the highest of their training, but also ensuring that they are providing care within their training. We don't want to overstep that because, again, we're going back to government being responsible for safety of our citizens. So a couple of things in particular. One is around pharmacists and pharmacy. And I know there's been discussion this past legislative session on that, and there was a bill that was passed, so anxious to see what rules come out of that with the Board of Pharmacy, but really looking at some other states like Idaho, I believe, that have been even more bullish there of some of those simple test and treat capabilities within our pharmacies. I think we also need to focus on areas of where has billing caught up with these changes of scope and practice. So maybe you've been able to go see a physical therapist without a doctor's note, but are you able to be reimbursed for that and have those payment systems actually caught up with that? I think there's some other interesting areas where we should look to have those conversations. Dentistry is one of them as well. When we look to our EMTs, our emergency services, when we talk about some of this mobile health provision to folks, we talked about our elderly, what does that look like? And so what kind of care can they provide, especially around chronic care and some of that diagnostic tools? How can we provide that? And from whom? And so I think those are the discussions that need to be had now. We've set a really good foundation around expanding that scope of practice, but now how do we take it to the next level? How do we refine that in some of these ways that I mentioned?
Do you think that expansion in rural communities where recruiting and retaining physician providers is already a serious challenge, do you see expansion as somehow in conflict with that?
Well, and we've got a shortage of all of these areas, right? I mean, and so we're not solving that just by expanding practice. And so everything comes back to workforce pipeline. Because sure, that's a great question. You could say, okay, you're going to expand the scope of practice. Well, I also can't find nurses. I can't find pharmacists. I can't find you name it. And so we're right back to that workforce pipeline and why that is kind of the number one focus area for me here. And so absolutely, that's an area. But I think there's ways we can be collaborative. One example I mentioned, my husband and treating moms, OB care in Laramie from Rollins. Well, what kind of coordination can we set up where there's nurses, there's NPs there that are coordinating with the OBGYNs in Laramie and having more of that coordination as part of this as well.
Thank you. Senator Barlow, you've spent more than a decade in the Wyoming legislature, been Speaker of the House, chaired the Senate Labor, Health, and Social Services Committee, and led the Mental Health and Vulnerable Adults Task Force. Given your institutional knowledge of why healthcare reform stalls in the legislature, and I know that many great things have also happened, so I'm not saying like it's not a complete stall. But what specifically would you do as governor that you couldn't do as Speaker of the House or as a committee chair to ensure a different outcome?
Thank you, Samin. So the governor gets to propose a budget. In a budget, you outline the priorities for the state of Wyoming. And if healthcare is a priority for our elder population or for our Medicaid and reimbursement rates, et cetera, then you have to advance or make a proposal to the legislature to advance that, So the budget is probably one of the prime drivers that a governor has that a legislator does not. Legislators get to amend the budget and ultimately pass the budget, authorize the spending. But when you get to start the conversation, that's a powerful place to be. Certainly respecting the legislative authority, ultimate authority in that, but you have to actually say, frame up the issue. We've talked about framing up the problem. Well, if under reimbursement is part of the problem in the state of Wyoming, then we actually have to talk about that. And that starts with a budget. Then the policies that go along with budget, and how many of you have been in a scope of practice discussion or in a legislative process? Just raise your hand if you've been in those. How many of you enjoyed it? Okay, I just want to be clear about this. Look, these are challenging issues. And having the honest conversations about where the challenges are in different communities, it'll be different things. How do we support those things? Those things? The last Practice Act that was passed in the Wyoming legislature was about 8 years ago. I was the one that, came to me from a community member, just like every piece of legislation I ever took up, came from a community and said, hey, we need a Practice Act for, happened to be acupuncture. And it's a robust discussion, folks. It's about giving more opportunity. But you know what it was ultimately about? Safety of the citizens. Because there was 48 states that had a Practice Act for acupuncture. 2 did not, Wyoming. So where do poor practitioners go? Where do they go? They were coming to Wyoming. So the budget is, I think, one of the primary drivers from a state policy perspective, and then working with the legislators and the work that you do in your communities with this strike team to identify meaningful things that can go forward and find legislators you can work with to advance policy. Thank you.
Thank you. The questions that we're going to move into now were submitted by audience members and have not been shared with the candidates beforehand. And we really appreciate your willingness to engage in these questions as you hear them for the first time this afternoon. So earlier today, we heard about the free market and drivers of healthcare costs. Most healthcare economists broadly agree that assumptions underlying free market theory, so informed consumers, price transparency, the ability to delay or forego purchase, and meaningful competition largely don't apply to healthcare and almost never apply in Wyoming. A patient, I think this was an example that Jen used, a patient having a heart attack 80 miles from the nearest hospital is not a consumer making a market choice. So given that reality, is the economic framework that guides your healthcare policy thinking different from your approach to other sectors of Wyoming's economy? So the way you think about it, specifically with healthcare, your economic framework, is that different than the way you think about other sectors of Wyoming? And Colonel Bean, let's begin with you.
I think my overriding thing is to put people first again. So, I don't know if it changes it much. It still puts people at the top. I think when I look at price transparency or the lack thereof, the lack of tort reform, because we know that malpractice insurance is through the roof, and of course that gets passed on to the consumer, which is really the patient. I think there's a lot of things that can be looked at here, and we know if you're up in the northeast part of the state, you may go to Rapid City or you may go to Billings. If you're in the northwest, it's probably going to be to Billings potentially, or maybe Salt Lake if you're in the southwest, or southeast. You may go down to Denver if we can't provide that here. So, I think, economically, I think it's one of those things that, we've built a few of these smaller hospitals in Riverton and in Pinedale, and I kind of wonder why, was that really worth the squeeze or not? I don't know. We've got to be able to staff them. We got to be able to have folks, those staff members be able to live in those local communities. And you kind of wonder, well, shoot, those for the cost of those, was there another option or not? I don't know the answer to that because I wasn't part of that. But economic drivers for it, I think that we got to look at the amount of money we're spending on healthcare, and I think as long as we put the people first and put them in the economic driver's seat, and again, my thing is to reduce the red tape that we've got out there, and I think that will ultimately lower the cost and a few of those other things I mentioned. That's just the way I look at that whole thing.
Senator Barlow, what about you? Do you have a dichotomy of economic frameworks that you use, like one that's specific to healthcare and one that goes for everything else?
Yeah, so I'll recall a discussion that was had at the UW building at Casper College, and a hospital CEO who was sitting in this room brought up a term, cost shifting. Cost shifting. Pretty. Everybody in this room knows probably what that means if you're in healthcare. That means that government reimburses below the cost of care, Medicare, Medicaid, et cetera, depending on where the care is being delivered. That means that everybody else, employers, self-employed people who are buying their own insurance, et cetera, are paying above the cost of care to make up that delta. So you can get to break even. So absolutely, the economy in healthcare is very different than the energy economy or the agriculture economy or wherever, because we have such a big part of it is government payers. Medicare, Medicaid, TRICARE, et cetera. And they pay at different levels, different rates, et cetera, in different settings. And so we have challenges. An ambulance that goes out and has a non-transport, there is no pay. No pay. So we have to think, in my view, you have to think about healthcare in a very different sense than all other aspects because of the significance of the government payer mix. It's just if there's a different way to say it or to think about it, great. But cost shifting is real. That is the challenge in the market. If we could shrink that, that would be meaningful. Very meaningful. So thank you.
Same question, Superintendent.
I would just add, and I'm a free market economist. I have my master's degree in economics, and I'm very much an Adam Smith economist, invisible hand. But we have to think critically when it comes to healthcare. The other thing I would add is we've got hospitals, they're fighting for their lives for payments, trying to crawl any dollar that they can. And so, what other space does that occur where you've got your business and you're trying to get every dollar for that purchase that's been made? And then couple that with Wyoming's aging population and the fact that I think it's two-thirds are on Medicaid. And so that complicates it as well. And again, the structure of who's paying what and how that break-even point, really occurs. And so that's why we have to think so critically and different about it in this sense. That is different, especially for Wyoming. And then a lot of times folks will say, well, we're just going to go after these big insurance companies. We're going to go after them. We're going to take them down. Well, they can leave, right? We're a rural state. They don't necessarily need us in a lot of ways. And so how do you balance that as well, recognizing that we've got to have that care here in the state of Wyoming?
Wyoming ranks among the worst states in the nation for access to mental health services, and most of our communities continue to face severe shortages of behavioral health providers. Recent reforms have shown some promise, but they haven't closed the gap. Earlier, when I first started speaking, I talked about a little bit of everything, everywhere, all at once. We know we've got a lot of challenges. As governor, what structural changes, so the workforce pipeline, reimbursement, delivery models, you've got to start somewhere because you can't do everything everywhere all at once. So as governor, what structural changes would you prioritize to make meaningful progress on those shortages? Senator Barlow?
So one of the things, and thank you. So the current governor, Governor Gordon, has done a lot of work in the behavioral health field space. And that work needs to continue. And I would respectfully say it's made a difference. There's much more to do. One of the I guess the biggest gaps in that I believe we have, and I'm confident we have, is for our adolescent and youth in the state of Wyoming. There are no services There are no inpatient services or limited inpatient services in the state of Wyoming for those highest acuity needs. It's tough. It's really tough when a family has to make a decision to send their child out of the state to receive the care they need, away from their, their support, their family, their support network, what they're used to. So a structural change, I believe a very meaningful change. We're doing a lot of things. We have lots of other programs, community mental health, et cetera. We're doing lots of things there. We've just did a big redesign with some of the members of the legislature. They're in this room. We're fundamental in that. That's actually rolling out right now, actually getting its legs under it right now. So we'll see the results of that in time. But for our children, adolescents, we actually have to step up and build a system for them. And I hope we do a better job and do it in Wyoming than what we have right now. So I think that's something fundamental, structural that we have to take on. And as governor, with your help, with the help of the folks in this room and those mental health, behavioral health professionals, I'll be a part of.
Thank you. Colonel Bean, the same question to you. The structural changes, what would you prioritize?
Well, I will tell you right now, I gotta echo the kids. I mean, that's really where it starts, and whether it's structural or not, this is why I'd want to see what's actually out there, what services we have, what we don't have, what kind of gaps we have. And I know there's a deficit, there's without a doubt, but it's more than just a healthcare solution. Obviously, this is community, this is parents, this is family, to get involved in that and make sure that these kids know. That there's a way, there's somebody you can talk to, whatever it is. And of course, I think some of this also is a part of this is in our public education. That teacher-child relationship, to where the teacher can see if something's going on, and notify the parents, and of course the parents being involved in their public education. But those services that need to be out there, they need to be, and this could be something that could be promulgated through public education or whatever the education the parents choose. On to make sure that their children or other children know who to reach out to, who to contact, whatever the case is there. So those gaps, whatever we can do there. But I think it's more than just a one-stop shop. I think there's quite a few things out there that we can actually do to really watch those kids and see what's going on and see how they're behaving and make sure they get the somebody's paying attention anyway to where they can get the care, because a lot of them aren't going to say anything. So we just got to be observant all the way across, and whether they're your kids or not, I think that we need to watch them all.
And Superintendent, how about for you?
Well, I think first we look at our existing programs that we have in place and make sure those are adequate. Our crisis hotline. It's one thing to say to a kid, there's someone you can call. Well, not if they call and they're on a wait list and then they're answered by someone in New Jersey. And so making sure that we continue to have that adequate crisis line in place. And then a couple of other structural things of how we build and move forward. Number one, we have a critical shortage of providers in this area. And so I'm interested in having these conversations about what does it look like to have a residency program in Wyoming around psychiatric care, and is there a possibility for that? It's also then building out telehealth. And when I think about telehealth, kind of the three main areas I'd like to target is around OB, chronic care, and mental health, mental and behavioral health, and opportunities there. And then education, I want to touch on that for a moment because it is so critical and where we are having such needs. And we've seen some success there. The recalibration bill did add counselors at the elementary level, which was something that I supported and advocated for. And we've tried other bills that we brought to the legislature that add in programs that are about identifying kids, being able to screen them and then get them help. Unfortunately, those haven't been successful. But I think there's opportunity there of how we work with parents to provide those services, and it can be outside of the school day, but within that setting. Where it gets difficult is if a school district is not reimbursing with Medicaid, then how are they funded for those programs? And so I think looking at ways we can continue to partner with our youth in that way are going to be critically important.
Thank you. Wyoming is receiving federal funding through the Rural Healthcare Transformation Act, but support is limited to 5 years. A key sustainability provision widely supported by legislators was stripped from the final plan. Without a long-term funding mechanism, any improvements we make with this investment will likely disappear when the federal dollars run out. Would you commit as governor to championing a state-funded sustainability mechanism, such as a perpetuity fund, to preserve those gains? Superintendent, let's start with you.
Well, and that was the first approach, right, for these funds was to create that, and we've been really good at that. I mean, we've had the foresight of our previous legislatures that created our permanent funds, which now, you look at our permanent funds that were funded by the mineral industry when times were good, second largest contributor to the state's general fund. And so we know that works. We're good at saving when times are good, so that we are in a good place when times are bad. And so unfortunately, we weren't able to have that, accepted by the federal government. But I think looking to your point of ways that we use this one-time funding, we have a one-time opportunity. And so how do you make changes structurally? And so that's why in my thinking, it's really about that infrastructure piece and then that workforce pipeline. Because we know that if we can start that pipeline with kids that are in junior high, high school, college now, that is going to serve us for many years to come. And so I go back to of kind of those focus areas of workforce pipeline, looking at partnering with our community colleges, higher education, and I know that discussion happened earlier today. I'd like to see how we can leverage that into K-12. I think that's a missing piece there. But also then on the infrastructure piece, and then about that collaborative coordination regionally. I think that's the best approach.
I'm going to push just a little bit more. So we know that we have the ability to start things, and 5 years is just a drop in the bucket. So to get some of this work done, it's going to need continued investment. Are you saying as governor that you would be willing to fight and champion for that additional investment required when 5 years are up?
I think that we have to be able to be collaborative in this. I'm always a big fan of public-private partnerships and how we bring all of these different funding mechanisms together. That's how our most successful programs start. And so I think that is absolutely the discussion that we need to have is how do we actually make this long-term funding? And so, yes, I'm committed to that discussion.
Colonel Bean, same question. So we're talking about the perpetuity fund that was stripped out of the plan and an idea about how will we maintain important programs that are started as a result of the Rural Healthcare Transformation Act.
Well, I look at this as both effectiveness and suitability. Obviously, suitability is the long-term part of it. And, whatever we do, is it effective? How flexible is it? Those kind of things. In the LSRA right now, we've got, roughly about $34 billion in there. I have no intention of putting any further tax burdens on the folks. So if there's a way to do it to where we can diversify some of the funds we already have, because we do. I mean, we do a pretty good job at actually setting things up and then earning interest over time to pay for certain things. And I don't have a problem with that, but it does come down to tax burden on everyday Wyoming Americans. So, I'd have to look to see what's actually feasible, what's practical, and when we've talked about our energy. When we get a boom cycle again, and we're going to have it, particularly with rare earths, is in coupled with the federal money that we're going to get here, is that we use that boom money. We build this stuff, we save, and then to where we can pay for those bust cycles. So I think it's one of those things I'd have to look at very carefully. But again, I have no intention of increasing the tax burden on the folks here.
And Senator Barlow.
Yes.
We've got a little bit more time, so I've got a few more questions. So what roles do you envision for the University of Wyoming and our community colleges in research and innovation to address statewide priorities such as behavioral health, aging populations, rural healthcare delivery, and chronic disease prevention? Yeah, I'm going to start with you.
Yeah, great question. And, no one loves the university more than I do. Proud graduate. This is where I met my husband. And so for me, prioritizing in the University of Wyoming is all about focusing on our land grant mission, which is to keep our economy running in the state of Wyoming. And so healthcare is a part of that. And so I think we absolutely need to look at where our hard to fill areas are, where our research needs are. And that is exactly what the purpose of the University of Wyoming is. The governor, of course, appoints the individuals on the UW Board of Trustees. We need strong advocates there on the trustees that are going to fight for Wyoming, fight for this land grant mission. And so this is critically important to me.
And we've also been in a time where we've been looking at some shortages. and understanding that there are budget cuts that have been proposed for the University of Wyoming and for community colleges. When we ask them to do more, there's an expectation that we have more investment. Is that also something that you would be considering as governor?
Well, I think it's always a discussion of how we're prioritizing at the university and making sure that we're focusing on those programs that, again, are involved in our economy, part of that land grant mission. And I think we should always be looking at a couple of things. And one is analyzing those low enrollment programs, or those programs that are not based in our economy in the state of Wyoming. And then number two, an area that I think we should always be looking at is affordability. Because you look across this country and higher education has become unaffordable. And what we've done is we pushed too many kids into college, and they come out with tremendous debt, and they can't pay it back. And so how do we make the university more affordable? Looking at, for example, the admin to student ratio, making sure that does not continue to creep up as it has. And so looking at how we keep it affordable, how we focus on the land grant mission, those should always be our focus.
Colonel Bean, the same question. So what roles do you envision for the University of Wyoming and our community colleges in research and innovation to address statewide priorities like all the ones that we've been discussing today?
Well, I tell you, I'd like to see the university take much more of a lead, and I think we do get back to our land grant roots, rather. And, it used to be, I got my engineering degree, and I wasn't a rocket scientist by any means, but, in 5 years. But, some guys were doing it in 4. Typically, it's taken between 6 and even more years now to do that. So we got to ask, why is this all happening? I do think we look at those curricula out there that are not important to Wyoming. Some of these superfluous things that they're teaching over there. And again, this is going back to the leadership of the school. Getting this school back to its land grant roots. I mean, we saw, what happened up in Washington State, about 8 or so years ago when they closed the port down there. Wyoming, UW should have been up there looking to see if coal dust actually was going to cause a problem. And obviously that didn't happen. But I think when it comes down to interaction with the community and local community, we see some of these satellite colleges, which I think are fantastic. We've seen some of the nursing programs, some of these other programs that do healthcare outreach. And I think it's, and they're very involved with the community because they're right there. So I think that coordination between UW and these surrounding colleges around the state, I think, is absolutely critical to furthering our health care, but really getting back to the land grant use, particularly roots here, particularly at UW, because the cost is just astronomical on what the taxpayers paying for UW.
And Senator Barlow.
So I think the part that I took out of this question was research and innovation. I believe that was fundamental to the question. And so I'll just point to a piece of legislation that we just passed in the Wyoming legislature unanimously, stem cell freedom. And that research is going on right now in the University of Wyoming. The basic research to support stem cells is going on right now. And now with that opportunity to be for patients and providers to provide that treatment in the state of Wyoming, there are companies, a particular company that's intending to move to Wyoming, 1, to provide the treatment, 2, to use the University of Wyoming as part of their research base. So this is actually growing an economy in healthcare in Wyoming, and that's meaningful. That's giving these WWAMI students and other students and from other parts of the state, from nursing students, et cetera, maybe a way to specialize in something and coming to the University of Wyoming to do it because the research is being done here. Oh, by the way, research itself is an industry. That's advancing science, but also medicine if it's in that particular field. So innovation, research and innovation, the university is obviously a part of that. New opportunities, policy opportunities, open those doors. And that's meaningful for the state of Wyoming and for the university. Thank you.
You're welcome. Is there anything that you particularly prepared on today to discuss when it comes to healthcare in Wyoming that you haven't been asked about and that you are just burning to talk about? All right, go ahead.
I would just, close with, this really is going to take all of us in this room. It's going to take experts in the field with policymakers to solve these complicated issues. These are tough, right? There's no silver bullet here, and this is a national issue that every state is grappling with. And so I just appreciate, all of you in this room, your commitment to healthcare in the state of Wyoming. We know that it's foundational to our entire economy. And so I look forward to working with you all.
I can move on to the very last question, and you can each add your final comments. Okay, so here it is. If we were evaluating your administration 4 years from now, what 2 or 3 specific, measurable healthcare outcomes would demonstrate success in your mind, and what actions would you take to achieve them? So again, we're evaluating the end of your first term and saying, these are the 2 things that we did, they're specific, they're measurable, and this is how I've been successful, and this is what I did to achieve them. Colonel Bean, let's begin with you.
I would say access naturally. I think home-based healthcare for our seniors, I think that's a huge one, and I would like to see more mobile healthcare facilities out there. I think particularly with telehealth and the technology that we have right now, I think there's huge advancements of that. I think it'll cut costs also. So, I'd really like to see that, as some of the driving metrics in mind. And of course, what I really want to do here is really try to cut the cost on this, particularly for the patient here, and obviously make it easier for you guys. But I will target the bureaucracy. I really will look at tort reform, those kind of things that actually increase the cost. But I think when it comes down to overall provisions for the folks, I think in-home healthcare and those mobile healthcare coupled with telecare.
Superintendent.
So a couple of things, and I think this is a great question because I think it should be measurable. We should be able to look back, and that's really what I've done as superintendent with our strategic plan. And we've actually, throughout the last couple of years, had this online tracker where, and every month we get together as a leadership team and say, have we moved on this, and what's our metric for this month? Because I think that's what we need to do more of in government, of again, not just have a report or an idea or strategy that really sits on a shelf. And so to me, it's number one, have we reduced the shortage of providers? Pretty simple there. And that's not just providers, right? That's all of our workforce within the healthcare industry. Have we reduced our premiums? Have we increased our collaboration? Do we have a better telehealth network going on? Do we have more access for people? Have we streamlined our EMRs to make it easier for that coordination, that collaboration that we've talked about? And so is it cheaper and is it more accessible for Wyoming people to achieve healthcare in the state of Wyoming? And I think those are measurable, and we should have urgency and accountability of our elected officials to be able to achieve that.
Thank you. And Senator Barlow.
So I just point to 2 things. One, how many hospitals have less than 100 days, 200 days cash on hand? Because we know right now many of our public providers, hospitals particularly, are challenged, and actually the legislature in 15-16 had to send some money out to keep some of them afloat. So have we actually improved the financial health of the institutions and the providers in the state of Wyoming? That is something very tangible. We can understand that. The second thing, I'll go back to the behavioral health through the entire continuum, continue to work on that, but particularly for our young people, for our children and adolescents. I don't want to be at the end of 4 years and have that. I hope we're, very much quite a bit earlier in my tenure as governor that we have something meaningful happening than that for our young people. So thank you.
Thank you. Well, thank you all so much for being here and for answering these questions. We know that this is an incredibly complicated topic. It's hard to come up with answers especially the more you understand how complicated every single piece of it is. And so really appreciate your time today and your willingness to answer these hard questions. Everybody, please give us their thanks. And I think we've got enough time for a short break before the next session starts. So you've got a little 15-minute break.